Okay. So I'm going to start with just a quick overview of general and just some general terms so that when we're talking, we even know what people are asking or when I'm, even saying, right? Because there's just a lot of misconceptions. And so, Medicaid in the state of Tennessee is TennCare. And a lot of people argue with me over that. And that's okay. I don't mind people. Oh, and you know what? I also need to let you all know. First of all, I'm just a special needs dad. I don't work for any type of company that does this professionally, right? I'm an insurance agent. I do have a license for insurance, health, life, and Medicare, so I can answer professionally questions like that. The rest of this is just my own personal experience or the collective experience from other parents. So please don't misinterpret anything that you're hearing tonight as like I work for the government or I work for an organization or a nonprofit or a for-profit or whatever. Okay. I do. I made a big mistake years ago. If anybody knows Senator Pody, um, he is a very big fan of trying to help special needs families in Wilson County. And I made the mistake of saying to him, we need more, I need more, we need more stuff. We need more help, right? And he said, fantastic. Let me get back to you. And he nominated me for this council. And for like the last 5 years, I've been going to these meetings, right? So be careful what you wish for. I got voluntold to be on this thing. So I do attend what's called the strategic planning uh, statewide planning and something council, whatever. I don't even know what we do anymore. But I do attend those meetings as a volunteer for as a parent. Okay. But I don't work for any companies, right? Just so that we're clear. Okay. On that stuff. So, that being said, for those that aren't familiar, because I get sometimes people will call me and say, like, hey, how do I get disability for my kid? And I'm like, oh boy, we gotta like we gotta wrap our brains around this, right? And so like there is Medicaid, which is TennCare in Tennessee. Now, Medicaid is a federal program, like think White House, think Washington, D.C., Senate, House, that kind of stuff. And then it's distributed out to Tennessee through TennCare. And then actually, I should have gone differently with these. So in Tennessee, you've got an MCO, and an MCO is your managed care organization. And in Tennessee, we have three of them. We have either WellPoint, which is formerly AmeriGroup. We have United Community. Now, this is not UHC, and this is not United. It's United Community. There's a this United has like 7 or 8 different divisions. And then it's Blue Care, not Blue Cross and Blue Shield, right? I know it's sounds petty, but there are some differences between this. And it's mainly what you see on your card, right? If you're doing that. And so inside Medicaid, which is TennCare, which is WellPoint, United, or Blue Care, right? Um, if you only have that, you cannot be a paid caregiver. Okay. Does that make sense? And I still only have like Amy and Lindsay, so somebody nod or like, make some kind of a thing. Okay.
Yes.
Now, and if I guess the biggest thing would be for the rest of of this evening, if you don't understand, please say something, or if it doesn't make any sense, or if you want to talk through it, like I can try to go deeper if you need it, but I don't want to stop for everybody unless we need to, right? So like if you have a question, feel free to stop me. Okay, this is meant to be interactive, but I realize some of y'all may not want to talk about stuff, right? So if that's the case, right? If you're only on one of those MCOs that has TennCare, right? You cannot be a paid caregiver. Also, if you don't have Medicaid, so some people on this might be on their private insurance, they might work for a company that offers insurance and they don't meet different criteria to get TennCare, to get Medicaid. Sometimes that's income driven, but not always. Unfortunately, that the answer to every single one of us is it depends, right? Is the answer. But I'm going to try my best to just kind of generally throw it out there. So if you don't have Medicaid or TennCare and you're on, like, you work for Nissan and you have a private plan, I'm sorry, a group plan from Nissan, then same thing. You cannot be a paid caregiver through that insurance alone. Okay. Now, some people say, well, why? Well, if that was the case, think about how much money, because that means every single person on TennCare and every single person on a group plan would be like, well, hey, I do this with my child, or I do this with my husband or my wife or my whatever, my aunt, my uncle, whatever I do, right? And they would all be getting paid to do different things. And it would be extremely difficult to control and all that kind of stuff, right? That being said, um, there are things that qualify, and many of us on this Zoom would be in that category, I would think. But you're going to want to get on a waiver. And I joke and I'm like, hey, it's a waiver. Like, I'm a waiver, you're a waiver. Okay, fair enough. I'm funny, right? But the reason it's called a waiver is it has to waive the rules from Medicaid, because Medicaid says you cannot be a paid caregiver. Medicaid says you cannot get, I think diapers is another one, right? I'm just trying to think of some examples. I may be wrong, and there's going to be some things I say tonight that are wrong, and I'm just like help me through it and just give me some grace, or feel free to correct me, but just raise your hand or jump in there. But like diapers, right? If diapers was through the federal government, and everybody on Medicaid got diapers, try to think about that, right? Every parent that's on TennCare getting diapers. So, but if you're on a waiver, if they have to waive the rules, then you can get diapers under certain circumstances, right? So everything is always certain diagnosis, certain this, certain that, whatever, right? So that's why it always depends. But the general answer is, if you are not on a waiver, you cannot be a paid caregiver. No different than you can't get diapers, right? So then you say, well, what the heck waivers can I get on? And I realize I just spelled it wrong. You're probably like, what the heck is an ECG? Um, ECF Choices is one, and Katie Beckett is another. Those are the two active that are still not enrolling, but taking new people. And then there's two older waivers. I don't think we'd have anybody on here tonight, but maybe. I don't know. I can't read everybody's mind, but there is something that used to be called the 1915C, and then there's something called Choices, all capital letters. Those are the previous waivers that have been closed. You cannot get in them, but if you were in them, you can stay in them, right? That's they phased out, or whatever you call it. And then there's new waivers because things changed, right? And Tennessee does things their way, and I'm one of those people that would tell you, like, that's the beauty of the United States. If you don't like Tennessee, nobody's forcing you to stay here, just like nobody's forcing people to stay in dare I say the word California, whatever, right? Because everybody thinks California is the promised land. If you can just make it across the line, they just start mailing you checks. And it's not that way in California either, although it's a little bit different, right? So if you're on the ECF Choices or the Katie Beckett waiver, which are the newest waivers, I'm personally on the ECF Choices waiver, okay? But here's the way you would know which one you should apply for if you're not on either. If you have private insurance or group insurance, or you're not on TennCare, then you would lean towards the Katie Beckett side. Now, ironically, you have to apply for TennCare and get denied first in order to then get Katie Beckett. Okay. Because they want to make sure you don't qualify through other things like a diagnosis code or something like that, right? So first you apply for TennCare, then you get denied, and through that denial, they'll look at you for Katie Beckett A and B, and I'll show you in a minute where to look at the benefit table. Because a lot of people are like, what the heck what do I even get? Well, it tells you right on the website. Nobody's hiding anything from you. No one's trying to deceive you. It's all right there. Same with ECF Choices, but on that side, that's going to be if you're already on Medicaid, which is TennCare, which is WellPoint or Blue Care or United Community. If you already have that, then you apply for ECF Choices. That's the waiver that you would potentially qualify for. I can't promise anything on tonight's Zoom. I can't tell you that, oh, yes, Amy, you will definitely qualify for this. Or, hey, Lindsay, you will definitely qualify. I can't do that, right? I can show you where to go to read, and then you can apply and go from there, right? So at the end of the day, that's what that looks like. That's how, if you're not on one of them right now, your step number one is to apply for either TennCare or ECF Choices. Okay, that would be your first step. Okay, then from there, once you're on now, then there's that dreaded waiting list. So we'll come back to that. But once you apply, you should get in to one of them, depending, I mean, again, depends on your diagnosis and all that different stuff, right? But once you're in, then there are ways to be paid as a caregiver. Okay. And so I'm going to just pause because I've done a lot of talking. Does anybody have any questions at this point? I can't believe it.
So
Oh,
just
go ahead.
to just to reiterate, you said if you have pretty much in the TennCare sector, you cannot be a paid caregiver. And if you have a private insurance, you cannot be a paid caregiver.
If that's the only thing that you have, okay, you have to have something. So if you have TennCare plus ECF Choices, then you can be a paid caregiver. If you have private or group insurance plus Katie Beckett, then you can be a paid caregiver. Does that make sense?
Yeah, thanks.
Okay. So you have to add something first. You have to get that waiver to waive the rules so that you can be in a paid caregiver position. Now, if your child is under 18, there are limits to how much you can be paid. And this is where, like, I said down here, paid caregiver only on waivers. This is where a lot of people land when they're talking about being paid as a caregiver. Now, for the folks that are on here that their child is over 18, I think I'm going to be able to share some stuff with you to clear up, this hourly wage thing. But if your child is under 18, you're limited by how much the Katie Beckett will give you total for the year, which is either 10,000 or 15,000, depending on whether you're in the. So let's look at that together. I'm just going to go over here to Katie Beckett waiver, right? And I'm going to go to benefit table, and there it is. This is what it looks like, right? And so you get.
All right, Hannah, let's go.
We get dollar amounts depending on. Sorry, I'm muting some folks only because it's gonna distract everybody. But so you get different things, right? Depending on what Katie Beckett A or B, and here's the list, right? And so you get either 10 or 15,000, depending on. Now, I just happen to know that. It doesn't say it on the benefit table because the dollar amount can change each year. So they didn't put it on here for the maximum. But let me say this. If you're already using the Katie Beckett waiver and you're maxing it out every year to your 10 or your 15,000, then there's nothing else that you can do. Like being a paid caregiver doesn't add to that 10 or 15. Okay. And then, like, as an example, I'm in ECF Choices with my son, and there's a cap. Like, I'm in group 4 trying to get into group 7. There's a cap. I think it's like 19,800. And so that's the max or the cap for the year. You can't go past that. So being a paid caregiver isn't in addition to, it's still part of that cap. So if you're already using all of your Katie Beckett funds every year, 10,000, 15,000, or your ECF funds, 19.8, I think is the new number this year. I may be off by a little bit. But if you're already there, then you're kind of not, like, the paid caregiver thing isn't really a good option for you anyway. Okay. Does that make sense to everybody? So, but here's, like, if you haven't done this already, you can just go to Katie, to this is, TennCare.gov or whatever, tn.gov, Division of TennCare, right? And sorry, I know some of you have anxiety because I have like 100 tabs open. I apologize. But you can go where that you saw me. I just looked up Katie Beckett, right? Katie Beckett waiver. You can type that into a little search bar up here, right? And you come down under here and under Katie Beckett benefits, here's the member benefit table. And I see stuff on the Facebook groups all the time. It's a waste of time. There's nothing else there. And I'm like, what? Has anybody ever looked at this thing? And you get assistive technology, minor home modifications, all this other stuff, right? There's all these different things. So there's just a variety, and that's not what we're here for tonight. So I'm just going to show you where it is, and you can look through it and decide, what you want to do there. Same thing with ECF Choices. If you go into the ECF Choices page under Resources, there's a tab that's the member benefit table, and there you go. This is everything in all the groups, right? So you hear people talk, like, I'm in group 4 right now. So you look up group 4 right here and you just scroll, and I don't know, there's like 15 pages of things. And then you want to get into group 5 or group 6 or group 7 or group 8 and so on and so forth. Fair enough? Okay. So that is the summary of that. Okay. Now, where I think there's a lot of confusion out there with being a paid caregiver is understanding the difference right here between, like, so if you're in Katie Beckett or ECF Choices and your child is under 18, in order to be paid, you basically replace a nurse or one of the home health aides or a PA, which is a personal assistant. So your support coordinator can give you hours under any of those categories. And maybe you're a CNA. Like, some people I think are legit CNA because they do it for a living or something, or they have this certification, or you can just go get it, right? And you can fill in some gaps where there might be some, not some providers that are missing from the community, right? But at the end of the day, that's what you're going to end up with. And you're going to get paid an hourly wage roughly between 15 and 19. It's a little bit different for each category, and it's a little bit different depending on what agency you work for. But you don't just get money from the government. They don't just mail you a check. You have to, like, go get it. You have to be an employee of a third party company. You have to get, like, CPR training and go through, like, onboarding, like HR, like if you were working for Nissan or, the government, or going, like, all that stuff, right? You got to have, like, email and a username and a password to get into the portal and do the trainings and all that kind of stuff. And then you are an employee of XYZ company, and then they pay you somewhere between like 15 and 19. I may be off on those rates, but somewhere in that range, right? And then that money, that dollar amount, goes toward your cap for the year. So if you're in Katie Beckett, A or B, you have caps, right? And yeah, so Lindsay, thank you. Sorry, you can use the funds for almost anything that benefits the child. So yeah, home modifications, absolutely. The beds, the babysitters, all that good stuff, absolutely. And then let's see here, what can you use the funds? Okay, great. So thank you for doing that. Lindsay answering the question and monitoring the chat. So thank you. So there's where you're in the hourly range, right? And so that's where you're punching a time clock and you're working for a third party company and you have like a boss and you have to put notes in and you have to do different things and all that good stuff. Okay. Now, this is where it's going to get a little bit like you may not have seen this before, I don't know, but for the parents of children over 18, and for us, like my son's 12, so I still got a ways to go. But if your child is over 18, there's a little bit of a gray area. Like when they're 18, if they're still in high school, they may or may not qualify. It's a little bit weird. So I'm gonna say I don't know the full answer on that. I'm gonna let you figure it out for you. Like you have to just let me connect you to somebody at one of these agencies, and they can give you the full blown answer. But generally speaking, once they get over 18, they're going to be able to, be in what's called the family model. Okay, and so that's a daily rate based on the group that you're in and the level that you're in. And you're like, what the heck is that? And so when your child is over 18 and they're out of high school, Katie Beckett ends, and that's when you're going to be applying for SSI and SSI and ECF choices because the Katie Beckett's going to go away for them. Okay, because they're going to, and the reason is because when our kids get to 18, 19, and they get out of high school and stuff, they go out on their own. And now all the rules change. And this is why everybody, and then parents get frustrated because they're being told they have to be evaluated again. And you're going, come on, this is ridiculous. Why do you have to? And it's because they're no longer under a parent. And this, believe it or not, this is actually better because you want them to get reevaluated and you want them to be in a position where now they're out on their own and they're not in a position to have parents taking care of them. So their score or their level or all these different things, um, they that number is going to change. And so whereas when they're living with their parents, then scores are like you're already in the house with them to help with bathing or different things, right? And I'm just using that as an example. But when if they're supposed to be independent at 19 and go out on their own, and now they can't do that, that's gonna like make that score, I guess, higher. I think it's higher. It might be lower. I don't know. So, but anyway, that changes like the group that you're in and the level inside the group. Now, what you're like, what are you talking about levels and groups? Well, I'm going to go over here, and you've got group 4 as the lowest level. Lowest is I don't just meaning it's the lowest number. I don't mean it's the least amount of needs. But you go up from there based on behaviors, based on medical needs, based on a variety. Can they do the ADLs? Can they toilet? Can they take care of themselves, right? And that kind of stuff. And so we don't know, like when they're in your home and they were evaluated 5 years ago, that score might be different today, right? And so you want that new score, that new evaluation, because this is now like we're going to pretend if your child went out there by yourself, by themselves. And so now they're going to look at it differently. And so now they're going to say, well, you could go facility, inpatient facility, whatever. But if you wanted to do the family model, and I'm just going to show you like what I did, if you just go and type in DDA services, or I'm sorry, DDA rates, like I just went to Google and typed in DDA rates, right? And then I boom, go over here. This big another wide open PDF. This is open to the public. You don't have to have a special thing to get there. Now all of a sudden you look at this. Whoops, sorry, not facility. There's a facility-based option, right? That would be if your child was in a facility. But we're going to look at the family model, okay? And you'll notice that kind of runs from here to here, right? And I think you'll know, obviously there's an out of state that's a separate scenario, so don't pay too much attention. But you'll see that the rates are the same, so that's all that really matters. But like that when people are like, oh, it's no big deal if you get approved for the paid caregiver thing because you're only going to go from $15.14 to, you know, $16.50. This has nothing to do with your hourly rate. I see people saying, well, once you're in group four, you can't go back. If you leave it, you can't go back. Not true. Like it's all based on the evaluation, and you can have your child evaluated once a year because their needs are going to change. And they may develop, they may not, they may regress. You guys probably know my son Ridley, and in some scenarios you might see him in the community, and he has good times and bad times. And so if you evaluate him during the good time versus the bad time, his score is going to be different. His level is going to be different, right? And so those things are going to change. So it's not one of those things like if there's a lot of fear out there that you're going to lose something. And at the end of the day, if you get evaluated and you land in group four, that's where you are based on the evaluation. And if you get evaluated and you land in group six, that's where you are. Now, a year later, you can get reevaluated. I think you can even just request a new evaluation, but I'm not 100% sure on that. Because, obviously our children change and their scenarios change. Just like things are changing when they turn 18 and 19, they're supposed to be out on their own, right? And that's where you're coming back in, and you may get them right here. There's an option with adult children that are over 19 and on SSI or SSDI. They might even qualify for Medicare. That's another conversation, not for tonight, but that's another option or another conversation. But as an example, look at this rate at level 5 or family model 5, whatever you want to call it, right? That's $309 per day. This has nothing to do with hourly rates of $15, right? And same thing with the next level down, right? Level 4, right? 4, whatever. It's $144 per day. Okay, so like I'm just gonna let's just go ahead and be as detailed as we can. If you're on a group, if you're in ECF Choices and your child evaluates out to a level 4, you're looking at $144.40 per day. And most months, if you all would agree with me, would have 30 days per month. That's $4,332 per month. Okay. It has nothing to do with hours. And I think that's where there's a lot of confusion, right? So depending on what level, now it looks like the lowest level is level 1, and that's $49.55 times 30. It's $1,486 a month times 12, $17,838. Okay. That doesn't go towards your cap. That does, well, I mean, it does, but like your cap is beyond that, right? And I'll let you do the math. You can see the screen, you can figure it out from there. And so, um, the family model is completely different than what you're seeing all these people. Because I personally, like, people are still saying you can't be a paid caregiver if your child's under 18. That's weird because my son's 12 and I'm a paid caregiver. And I've said that in meetings and in front of people, and they're like, okay, I don't know what to say. Because you can. You just have to know what you're doing inside the system. Yeah,
Uh,
right?
quick question.
Yeah.
So let's say if you have multiple kids under one household, are you paid professional caregiver per child or just for the house?
It's per child.
Okay.
Yes, sir. Um, I see something over on the chat. Hopefully you guys are monitoring that for me because I'm not really looking at too much there. But yeah, you don't have to be a CNA to be a caregiver. There's a couple of different things that you have to be a CNA for. And if you're not a CNA, you can't do it. But that's the hourly wages for under 18. That's not for the family model. Now, the next question is family model only for caregivers who don't live with you can do either or, live with them or not live with them. And maybe the goal is to try to get them to come back if they're in a home or in a facility, and there's options there. And that, again, it's all this stuff, you got to navigate that, right? You have to go from there. Now, so that answers that question. Now, a lot of now let's be clear because I was just critical of some people, maybe even some of you on this Zoom, and sorry if that hurts your feelings, but that's just like I said, like there's things have changed. This was because of the legislation that was passed last year, right? And so I know that we all can be very critical of our government, but in the same breath, I think we should celebrate when they do good things. So that like it's just like we celebrate our kids when they do good things. And so you can still be mad about other things, right? And I'm not going to go into the political stuff because I don't none of that matters to me right now tonight. I'm a parent and you're my peer, you're parents or you're in the community to support our children, right? But at the end of the day, your senators and your House reps went out and did what we asked them to do. Now, the law that they passed doesn't specifically say pay caregivers because that's not how laws work. Even the law that recently was passed to require TennCare to treat pandas, that's another example. It doesn't say that in the law specifically. It uses the legalese language that they have to use to give TennCare the code that they can use and the diagnosis and replacement of pandas, which is not currently recognized, right? So in this case, when the legislation was passed, it just says that TennCare cannot discriminate against you for being the parent or the family member, right? And it also specifically states, so pay attention if your child is either 18 or older or coming up to 18 or older, because it specifically states in the law that if you have a conservatorship, the language in the law, I'm sorry, I said that wrong. The language in your conservatorship has to state that you are allowed to be a paid caregiver. So if you already have a conservatorship and you put it in place prior to this law taking effect, right? Which was like 6 months ago. I think it went in like in August of last year, 2025. If you have a conservatorship in place, you might have to go get your attorney to change the language because it has to specifically say Tyrese is allowed to be paid as a caregiver for such and such child. Sorry, Tyrese, I hope you don't mind me picking on you. But at the end of
Yeah,
the
no
day,
problem.
if it doesn't say that, you're still stuck. Okay. So if you need a referral to an attorney, I can introduce you to some, but that's not why I'm here tonight. I'm just saying, like, go get you an attorney, change the language in your conservatorship. That's how you get around it. So the government gave us a way around these obstacles, these rules that TennCare was using to not pay. So I hope that makes sense. So you have to have that language in as a conservatorship, and all it did was allow us to go find these agencies to work for and become paid caregivers. Okay, but it has nothing to do with these rates that everybody's talking about online. And I always think it's funny. I'm going to be a little bit critical, but all the loudest voices of people that are out there saying this stuff doesn't exist and the rates are so low and all this other stuff, none of them are on this Zoom because it's just noise. It's just noise to create fear and questioning and whatever else. But there's not a single person at DDA or TennCare or your insurance provider, if you're on a Medicaid waiver, that would tell you that. Not one.
May I ask a question?
Yes, ma'am.
Hi. Okay, so Katie Beckett is capped at, the 20 or the 15,000 or $10,000 for caregiving.
Right.
Okay. Now, it seems like ECF Choices is the one that's going to benefit all caregivers.
Yeah. So when the child, I know it's confusing because I mean, like it's the government. This is where I get to make fun of the government. Sorry if you work for the government, but the government never makes anything easy, right? But if you're under 18, right, that's where like you gotta have Katie Beckett if you're on the private insurance. And ECF if you're on Medicaid. That's the only way it works. But once your child goes out on their own and they become independent, which is normally 18 or 19, that's when they go out. In other words, they file their own tax return, they get SSI, and they make $941 a month or whatever the SSI thing is, right? That is only ECF Choices. Katie Beckett is gone when your child becomes an adult. I know it's tough because sometimes we think of our kids as never becoming adults, right? Because they're still dependent on us. But the government specifically draws that line at 19, and it can be 18 if they're not in school. And so once they hit 19, they're off of Katie Beckett for good. And that's when ECF Choices would be the better route to go. So I think that answers your question. But at the end of the day, ECF Choices is the only option for the adult kids. Is it the better option? I don't know. I think when you look at ECF Group 4, which is where the overwhelming, I mean, I think there's like 2,600 people in ECF Group 4, and their cap is 19,000. And then Katie Beckett, one of them, A or B, I can't remember, is 15. That's pretty darn close. 19 and 15 is pretty close, right? Remember, if you're on ECF Choices, you're also on Medicaid, so you're not paying for your insurance. So there's a little bit of a extra benefit there. It's zero cost. But in the same breath, those numbers are close. But when you get into group 5, 6, 7, and 8, I mean, the group 7 cap is $256,000. But that's because you might have, like, you're talking about in-home ABA, you're talking about inpatient facilities, you're talking about a variety of different extra things that are meant. And I think right now there's only 57 kids, that are in group 7, to put it in perspective. That group 7, the like, I'll just use my own son as an example. If you come to my house, I've got holes all over my drywall. I've got broken windows. Both my garage doors are destroyed. My wife has had a broken nose 2 or 3 times. That's group 7, right? And I'm just saying that's just a behavioral example. I'm using my own example so I don't have to ask other people, right? But at the end of the day, that's what that looks like. But there's a lot of other supports that come in. They have parent trainings and assistive technology and all these different things. I've got locks on every one of my doors. I've got, all these, a special stove that my son can't turn on because he used to set fires, and, a variety of stuff. I could probably write a book one day, but I'm only saying that to give you some examples, right? So when they're kids, Katie Beckett and ECF are pretty darn close numbers wise. Now, Katie Beckett is a little bit more of like an HSA. So as one of the downsides to ECF, even though it's 19,000, like, I can't go get an above ground pool or like a water slide with my money from ECF Choices, because that's not how I get it, right? But if you're on Katie Beckett, you can go get Dollywood tickets, right? And so it's different. So yeah, some parents are going, oh man, I wish I was on ECF Choices because I'd get 19,000 versus my little 10,000. Maybe, but you also wouldn't be able to get, like, I can't get some of the things that you can get on Katie Beckett, because there's that magic wand that exists on Katie Beckett that is the letter of medical necessity, right? If you can get a letter of medical necessity, you can get anything you want, but not on ECF Choices. It has to be approved by your MCO. Like, United has to say, yep, we will pay for that. Does that make sense? Hopefully that answers the question. So again, I've done a lot of talking. It's 8:15. Who else has questions? I think
there's
I hope we,
I'm
ahead,
sorry.
Amy.
Yeah. There's a question in the chat, and I read it, and I kind of had a moment. She was saying that her ECF Choices coordinator was telling her the stipend is better than the family model. The stipend for ECF Choices caps out at 1,000.
Yeah. Yeah. See, this is where, like, again, I don't want to hurt somebody's feelings, because somebody might be a support coordinator on here tonight, but like, some of these support coordinators just got hired last week.
Right, but they're telling
Right?
the wrong information because it caps
Yeah.
out at 1,000.
Are you
That's it.
kidding me, Amy? Come on. No, Amy, I'm going to call you out on this. There is no way somebody from the government is giving us incorrect information. No way.
No way.
That is impossible.
Absolutely not.
I'm going to mute you and kick you out of here and ban you from the groups, Amy. You are dead wrong. Sorry. You see where my sarcasm comes out?
No,
Yeah,
I
and
get
so-
it because I read that and I was like, that is that. And I feel bad because I know it caps out at 1,000, but I also just by the chart you just showed that is on their website.
I mean,
The family
there it
model
is.
is more.
There it is. The lowest level on the family model is more than that.
Right. And that's the coordinators telling people. And it took me years just to get the stipend because I had to use the right words to ask for it.
Oh, you touched on the
hit a
last thing I
button.
was going to cover. I'm gonna close with that because that's gonna be the tough one. But yeah, you're exactly right. And Amy and I are on that same SPPC, whatever that means. We don't really know. I don't really know. Statewide planning and something.
Statewide policy and planning, I think.
Policy and planning. Thank you. So I see Amy in the community, but yeah, that's the sad part is, and again, I was a new hire at one time, or I've worked at companies and I didn't know all the answers. And so I feel it stinks that they're giving bad information. And that's why I kind of wish like parents have to stick together. You know, I'm on here tonight just to help people and here's why. People are like, why are you doing this? What's the catch? What do you want from me? How much money are you making from this? Let me tell you this. The reason that I do any of this stuff is because there are other parents that have helped me. That's it. And so I'm an old recovered alcoholic. And I was always taught that you freely give to other people what they freely gave to me. And so I had a guy help me get sober. And so I help other people and I don't charge for it. And it's the same thing here because the only way I can do this is to help. And that's why every time somebody says, well, my care coordinator said this, my care coordinator, okay, well, let's just do the math. Let's just open up the website and look at the ECF Choices table. Somebody told me I can't get assistive technology in group 4. That's weird because it says it right there on the thing.
Scott,
So
I have a
to
question for you.
I'm sorry, go ahead, Mandy.
I said I have a question for you if you have a minute to answer that.
Yeah.
So
absolutely.
I was talking to Amy also in the chat, and not for myself. I know that you don't have to be a CNA to be the caregiver, the paid caregiver, but there are families that reach out to me all the time, and the mom is already a CNA by her profession. So I want to know where is the information that I can find to lead them to become the CNA for their own kiddo. And sometimes the moms will be like that, I want to become a CNA. What do I need to do to become one so that I can be paid as a CNA paid caregiver for my either young child or the adult?
I understand the question.
young
So the
adult.
answer is if you want to be the language for CNA
Mhm.
is home health aid. A home health aid is somebody that the insurance company, the MCO, so WellPoint, United, or Blue Care, they require that home health aides be CNAs.
I don't think so. The supportive home care is what they call the home health aid in Katie Beckett Part A. And the CNA is different.
I don't know
and their
about Katie
pays
Beckett.
are different.
Yeah, I don't know about Katie Beckett. I'm sorry.
But
I don't mean
but
to
in
cut you off.
the ECF, it's the same.
Well, I just know that when my son, because the reason I'm saying this is because my son was qualified for home health aid hours.
Yes, yes.
And they were looking for a CNA and they couldn't find one.
Okay.
That's what I was told by the provider.
But
Now,
most
then
of
they
the
switched
home
it
health
to-
companies, when they are looking for a home health aid or a supportive home care worker, they are looking for a DSP, which is a direct support professional. And the CNA comes under the medical side when you get the private duty nursing, the PDN from your doctor.
Mandeep, you're exactly right. I got it backwards. I did it. I did it backwards.
Yeah,
Yep.
I'm trying
It's
to
private
understand
duty.
it too, because I have
Yeah.
so many families come and ask me and I don't know
Yeah.
how to answer them. So
No,
I'm I'm
yeah,
like, and
you're
if you
exactly
want
right.
to answer it off this thing because it's probably too long or whatever, I don't want to hold you off for this.
No,
I can always catch you later.
yeah, that's the answer though. Private duty
Okay.
nursing. You're exactly right. Private
Yes.
duty is the one that's the CNA. Home health is
Yes.
the non-CNA. You're right.
Yes.
You're right.
Yes. And the
And that's it.
second question that I have for you is the family model. I got to know about the family model from Amy. We were talking the other day. So how do we direct families to get that set up? What are the steps required for that? Where do I go find that information?
Good question. So in order to do that, first of all, your child has to be 18 or 19, right? So
Yes.
if your child's 14, you're wasting your time.
No,
But
I'm
or
looking it for
6,
the families who are in ECF choices because I wanted to actually introduce myself. I should have done that. I work as a family advocate with Family Voices of Tennessee, and I oversee the families of ECF choices. And I always get this question pretty much every single day from moms, like, do I do the stipend? Do I do the family model? So I want to understand it for other people. My kiddo is too young. My kiddo is only 9.5 at this point. So I'll hopefully have it figured out by the time he's 18. So that's why I'm asking this.
Yeah. So the first thing you would do is you would talk to your support coordinator and say that you would like to have a new evaluation done to see if they would qualify for or to
Different
see what group and what level they would qualify for.
Yes.
And then once you've established whatever that is, so whether it's level 1, 2, 3, 4, or 5, there's 5 different levels on that screen with the rates.
Yes.
Then they would be able to say, okay, you're based on the evaluation, your child is going to group 4, but they're a level 2, or they're a group 6, but they're a level 4, and whatever, right? And there's probably ways we could dig in to try to figure that out, but at the end of the day, that you just have to go through the evaluation. That's where they ask all the questions about, can your son or daughter bathe themselves? Can they toilet themselves? Can they?
The eligibility
understand,
criteria, the
danger
level of
and
care,
all the different stuff, right?
Yeah,
And
I have that document with me.
And so that's where you start, is you ask for that evaluation, and then you get the level, and then you say, I would like to be on the family model. They can't stop you. And if they do, you ask for their supervisor. And if the
no, we are
supervisor
not going to
doesn't know
let
it,
them
then
stop
you go
us
to the
there.
next supervisor and you just keep going.
Let me tell you, Amy is my mentor, so I'm not going to let anybody stop me there.
Yeah, and I'm just generally talking for the group, for everybody else that might not be working, or might have a support coordinator that's telling them that the stipend's better, right?
Yes.
Okay, now I see a question. Sorry, did that answer everything?
I had a question.
Yeah, go ahead, Tammy.
Hi. So my son is 22 and we are on the EFC Choices going on almost 2 years now. Does the paid caregiver, we can't do anything until he's on EFC?
Yes, correct. ECF.
Or ECF, I'm sorry. So there's nothing for us.
So you have applied for ECF?
Yeah, he's on the waiting list.
Okay. So the short answer is yes, there's nothing that you can do right now until he gets in ECF Choices. Okay. On the wait list, you're just stuck, right?
Okay.
Now, and I see some other questions in the chat about the wait list. So and Amy, I think, knows where I'm going with this. And so I'll just
Scott, if you don't mind, can I answer this question for the wait list thing? So I just got those numbers out on my groups. So the government did pass a bill or allotment, you can say, for 2,500 new slots. And they do have a wait list of 1,770 people at this time, but new slots, which is numbered at 2,500, has been allotted to ECF Choices, and hopefully they will start rolling those out somewhere around July.
There you go. That's certainly one way of doing it, right? I mean, when more slots open up, that's when
So hopefully we'll see some commotion in the enrollment
Right.
Yes, but they do have some people aging out of the program for other reasons, or some slots making up, not aging out of ECF, but changing the group. So I just talked to a family who got accepted yesterday into ECF.
Oh, wow.
So it does happen.
Is
Yeah.
there somewhere to look to see like what number he's
No,
at?
let,
No.
so let me
I
show you.
don't
I'm
think
going to
so.
show it to you.
Okay.
Yeah,
I'm going to
okay.
show it to you. Give me. Let me have the opportunity here to show you what it looks like.
Okay.
When there's a wait list and there's not enough slots, right? It's just, first in, or last out, first in, and that kind of thing, right? But so when you get a chance, go to that ECF Choices page, right? Can you
Right.
see my screen still?
Yes.
Employment and Community First Choices. Go to Resources. Click on the green page.
Okay.
Okay. This is how you get off of the wait list.
Oh.
Read this. And the reason I'm going to sound a little bit secretive, okay, and I'm not trying to be, I'm just trying to make you think. The green page is something that says we have, like, if you just look right here, we have limited space to enroll these groups now.
Okay.
It doesn't specifically say this is the document that will help you get off the wait list, but it's pretty darn close. And so I'm just going to use my son as an example because remember, I told you I don't work for anybody, right?
Right.
Here, my child is under 21, right here. And it says the behaviors are so challenging that you're at risk of being placed outside your home, but your family is willing to be part of your treatment and wants services that will train and support them to be able to support you so you can keep living safely together.
Oh.
Now, I'm going to let you read between the lines.
Okay. Yeah.
Okay. I'm going to let you read between the lines and
Okay.
just tell you what I did with my son. So this is painful to say out loud. And a lot of what we do as parents is painful. And I'll tell you this, every one of you on this Zoom is doing a fantastic job. And it's hard. And I can tell you that I look at my son every day and I don't think it's that bad. But to any other parent that doesn't have a child with special needs, what we do is impossible. And so sometimes we downplay because of different emotions and different feelings and different whatever, shame, guilt, variety of different words can be inserted there, right? And so when somebody says about, like, when I talk about Ridley, I don't talk about the holes in the wall, but they're there, And so a lot of times we think that our children are awesome because they are, but in the medical world, in the waiver world, and in the whatever world, right, they're not. And so I accidentally, I didn't, nobody ever told me this, but things got so bad in my house, I had to quit my job. And I spent 4 to 6 months, I can't remember exactly how long, I never really looked it up, but with no income, no job, I was just home trying to keep my son from destroying my house and beating up my wife. And I finally called him up and I said, I can't do this anymore. I specifically asked them to get ECF, not ECF, DCF, or I think it's DCS now. I was like, somebody come get him. That's hard. It's not something, it wasn't my most proud day as a dad. So and this is being recorded. So, I'll say this. I said, come get him. And here's what happened. And I don't know if this is going to happen for you or not, because this was years ago. I'm just sharing my own experience. The woman that I was talking to on the phone, put me on hold and came back and said, what would that change if we gave you a slot in ECF Choices?
Oh my gosh.
I don't know if she waved a magic wand. I don't know if I pressed the right button on the phone and got the right person. I don't know. But I can look at the green paper and I can tell you, or the green page or whatever it's called. Yeah, green page. And I can tell you this is what they use as their criteria.
Okay.
And so if your child reaches any of the stuff on the green page, then you should come off that wait list and you should call them. But I don't know if I would call and say, hey, I was looking at the green page.
Yeah. No.
I don't know if I would do that or not. You know, maybe. I don't know.
Well, and his coordinator said when he did the evaluation, he put him in group 6 is what we're waiting for, I guess.
Well, I would say that if your child gets to the point where the behaviors are so challenging that they're at risk of being placed outside the home, then it might be time for a follow-up phone call. Maybe.
Okay.
Maybe.
I would say it's time for a follow-up phone call no matter what.
There you
Yeah.
go.
And that's where it comes to looking at that page and finding the right verbiage, the right words to say. Because if you don't say those words, and this is in my own opinion, in my experience, if you don't use those exact words to convey what they're trying to say, where they're on the page, they don't say anything. You have to tell them what you need and want.
Okay.
Thanks, Amy.
Yeah.
So there you have it.
Thank you.
Did we answer every question? I see one in there about the letter of medical necessity. Can you clear that up? How is that different than Katie Beckett or ECF? So on ECF Choices, there is no letter of medical necessity. ECF Choices has very clear guidelines of what's paid for and what's not. Okay. With Katie Beckett, the letter of medical necessity comes from your primary care physician, or I guess a specialist could do it too. I think, maybe not. I don't know. Maybe somebody on the call knows, but the letter of medical necessity would be the example would be your primary care physician agrees with your occupational therapist that your son or daughter needs more sensory input, so you need a trampoline in your backyard. And they approve up to $3,000 for a trampoline in your backyard. That's an example of Katie Beckett versus ECF. With ECF, they're like, no, we don't pay for something like that. Now, ECF has different rules about durable medical equipment like wheelchairs, but that also includes like car seats and beds and different things. Whereas Katie Beckett, you can get your primary care physician to write the letter that says, yes, this child needs a cubby bed or a haven bed or whatever bed, right? And then you can go out and get it. Whereas ECF, you go to a place where they evaluate your child and they tell you this is the bed that they would qualify for. This is the car seat that they would qualify for. My son can't sit in a car seat. He can get out. He's Houdini. So I had no choice but to go pay for an Easy On. It was like $395 for the Houdini harness that they can't get out of. And that isn't something that ECF pays for. So, okay, life goes on. I didn't lose a lot of sleep over it. I'm grateful for the waiver. I'm glad that I get some things. I don't get everything, you know, and that's okay. But I do get a stipend as well. I get $500 a month. So I took my stipend that month and I paid for the new Easy On thing. So hope that answers the question. Is there a green page for the Katie Beckett waiver waiting list too? Not that I know of. So that one unfortunately is just you have to wait for people to drop off or more seats to open up.
There is a document called Level of Care Eligibility Criteria.
There you go.
And they have the tier 1 medical, tier 1 and 2 behavioral, and Katie Beckett Part B. It exactly describes what you need when you get for waitlist. It's Part B is first come, first serve. For Part A, it's severity basis.
Is that this right here, Mandy?
Which
The
one?
Katie Beckett
Let me-
level of care criteria.
Yes, sir. That's the
There you
right
go.
one.
See, it's
Yes,
all
sir.
on the website. If you're on Katie Beckett, I would highly recommend that you go to this webpage here and just look at all of these. Like open up all of it and read it and
Yes.
look at it and study it and see how it fits into your kids, right? Resource documents. And then the same thing with ECF is you've got where'd it go?
Green and the pink page.
Well, but you've got this resource tab down here at the bottom.
Yes. Yes.
So, resources, and then there's everything. There's your benefit table, your green page, your pink page, the brochure. Because I think the brochure, does it have the little graph on it? One of them has like a little, because it's so good to, here we go. This one here has, this is my favorite thing because it's visual. So right here in this like section right here, how old is your child? Under 18. My child already is on TennCare, apply for ECF. Like, boom, done. And like people argue on Facebook. They're like, no, you did. And I'm like, oh, that's weird because there it is. And then as soon as you show them this, all the comments stop. Amazing. When you just put public information in front of somebody that wants to argue, right? Okay. Any other questions that one waiver? Did you say that just one waiver? Yeah. So when you're an adult, meaning 19, it's just ECF. Now there might be you might hear somebody say 1915C. Don't worry, you're not missing. Like you can't get into that. That's for people. I think most of them, their kids would be like more than 30 years old now, 40 years old, and so those are for families that came before us. In fact, those are families that gave me most of my information, right? But then then I got to turn around and help those same families because they didn't know about the new legislation. Not many people know about this new legislation. Very few. And then even then they're getting bad information because they got support coordinators saying, well, the stipend's better. No, it's not.
Well, as you know, I'm just starting to go through this family model process.
Yep.
And because I have conservatorship, I have to get a lawyer. I have to change that. I have to do the level of needs. I have to do all the documentation, which I'm working on. It's really hard, like you said, I look at my daughter, I'm like, I got this. But to spell out a level of need to make sure that they get the care and the support they need it's a little bit difficult sometimes.
Yep.
But it's a lot to go through all of this. And mine's 21. She'll be 22 this year.
It's a lot. But get on the family model when you can because that adds up. Get on Medicare when you can because that adds up. Those extra benefits, that Medicare Advantage plan, that's a monthly grocery card that adds up. Get on the stipend, get on ECF Choices because that stipend, like those are things that it adds up, right? And so the other thing is, none of us are going to be here forever. Most of us are going to die before we reach 150 years old, and so that means our kids, they need this stuff for the future because we may not be here tomorrow, right?
There's a question: how do you get both the hourly rate and the daily? You can't get both.
No, you can't do both.
You lose
but
the stipend.
You just you could get the stipend. You're exactly right. But why would you want? Yeah, you would want the daily rate before you would want the hourly rate for sure.
Right. Yeah, because they're two different things. From what I understand, because like I said, I'm in the beginning. When I go into the family model plan, I'm going to lose my respite funds and my stipend. I'm only going to get the daily family model funds, which I think is another thing that's confusing that the care coordinators aren't explaining.
Yep. And that's, like I said, they don't know. And then this law just changed, and a lot of families don't believe it. A lot of people are like, no, and they're worried that if they do this, they're going to lose this and whatever else. And it's like, well, all we can do is give you the information, and what you do with it from there is up to you. So we're going to close out. It's been an hour. I'll stay on for a little while, but let me say this. I don't ever share anybody's information unless you give me permission. But if you're on this Zoom tonight and you are interested in, pursuing this and need help, I can introduce you to people. you've got my email because I sent you the link for tonight's Zoom. So if you want me to introduce you to somebody like an attorney for a conservatorship, or like, the agencies that do the paid caregiving and whatever else, feel free to email me back, and I'm happy to send you out to the people that I work with in the community that I trust, right? But you can also do it on your own. You don't need me. I mean, and you don't need, whatever. But I'm just offering that. But I would never just, like, in other words, I'm not going to send everybody's, name, phone number, and email over to people and say, hey, good luck. I hope it works out. But if you want something, or if you need help or whatever, reply back to the email and say, please introduce me to somebody for this, or, whatever. And I'll point you in the right direction to like a professional that can help you get those things going. Okay. So I wanted to close with that. This would be a good, like, if you're done and you got everything you needed, you can jump off, but I'll stay on for a few more minutes if you have questions, or, whatever.
That dude, good me.
Thank you. I thought it was a good one too.
Bye.
Good night.